Well, my friends, this is a rare and very serious case of a gentleman aged about 35 years. He has come from the Chandrakona town of Midnapur district of Bengal. The name of the disease is Spastic quadriparesis. Paresis means weakness, paralysis. Quadri means four. By two, try three, quadri four. That means two hands and two legs all are become paralyzed and paresis, and that's why the name quadriparesis. So paresis means weakness, paralytic conditions of both the limbs, both upper and lower, the two hands and two legs, the superior extremity and inferior extremity is undergone paralytic conditions. That's why the name is quadriparesis. And spastic, that means spasticity, hardness. There is increase in the muscle tension, which leads to the arm and legs muscles reflexively contracting when they are stressed or moved. This is spastic quadriparesis. The disease is well diagnosed already from the prestigious Institute of India, National Institute of Mental Health and Neurosciences of Bengaluru. In short, the institute is known as NIMHANS. So, as a result, the movement of the extremities becomes jerky, becomes difficult, and the daily tasks are difficult to do, difficult to perform, they are impacted. So, this is quadriparesis. Now, the life of this person is difficult to walk. About 4 months back, the gentleman was more or less all right. He suddenly noticed difficulty in getting downstairs, more with the left leg, and he developed a tendency to fall. He also reports stiffness of the whole lower limbs. He used to trip and fail on small objects and walking over uneven surfaces. He has mild distal upper limb weakness and more difficulty in doing the fine works or activities. He has urinary urgency and occasional incontinence of urination. So, he has also noticed twitching of the muscles of the arms, of the abdomen, chest, and other parts of the body. But there is no history of cognitive decline or any cerebral symptoms. So this is spastic quadriparesis, which causes an increase in the muscle tension, which leads to the arm and leg muscles reflexively contracting when they are stressed or moved, my friends. As a result, movement of the extremities becomes jerky and difficult, and many of the daily tasks are impacted. So, generally, spastic quadriparesis is caused by problems originating in the brain itself. This type occurs when muscles in both the arms and legs are afflicted by weakness, which may either be stable or worsen over time. Individuals with flaccid quadriparesis have lower overall muscle tone and generally experience significant fatigue with normal activities. Usually, flaccid quadriparesis originates from the spinal cord. So, there are two types of origins, either from the brain or from the spinal cord. There are several unique symptoms that may be present with quadriparesis depending on which version of the conditions of the practice of medicine varies. So all the books, all the chapters of the neurology or neurological science deals, the great significance is the increasing muscle tightening and hardness of the arms and legs muscles. These muscles in these areas reflexively contract in response to being stressed or moved, particularly when moved quickly. তাড়াহুড়ো করতে গেলেই যেমন তুমি পড়ে গেলে, কুইক মুভ করতে গেলেই প্রবলেম হয়. This can ultimately lead to joint contractures in which the arms or legs become stuck in a particular position due to abnormal muscle activation. So this is in short about the disease spastic paraplegia, my friends. So what is flaccid quadriparesis? These are somewhat opposite symptoms. Individuals with this condition will experience significant muscle weakness in their arms and legs with weak or absent of reflexes. They seem floppy and normal movements can become labored, which due to disturbances, lesions in the spinal cord. So there are wide variety of underlying conditions that can cause an individual to develop quadriparesis. I have already told the brain lesion and spinal cord lesion. There may be congenital versions, which are those present from the birth due to cerebral palsy, and the acquired are either from brain or from spinal cord. Now, what will be the homeopathic treatment? In homeopathy, no questions of the disease, whether it has been it is spastic paraplegia caused from the brain or spinal cord, matters little to us. One of the important medicines is causticum. Causticum, Hahnemann's tincture Arsine acris cali, the very, very important medicine, and Dr. Nash has clearly described about causticum as a wonderful medicine in his hand, and to me too, because causticum are very, very important for these conditions: paralytic weakness of the limbs, contractions of the limbs, contractions of the joints, tensions of the joints. So contractions and indurations of the tendons of fingers, of the muscles. The muscles of all the muscles become stiff. The man cannot walk properly, cannot stand properly. একা দাঁড়াতে পারো? কষ্ট করে দাঁড়াতে হয়, দাঁড়ানোর চেষ্টা করো, একটু সবাইকে দেখিয়ে দিই. So this is very difficult gait, difficult to move, because all the muscles become stiff, contracts, You know, the muscles of the gluteal region, the extremity muscles, including the gluteal muscles, become stiff and indurated, contracted. You know, the muscles of the gluteal region are gluteus maximus, gluteus medius, gluteus minimus, gemellus superior, gemellus inferior, piriformis, obturator internus, and obturator externus. Now the thigh muscles are posterior compartment, medial compartment, and anterior compartment. In the lateral side, there is no muscles in the thigh. Now the medial compartment are gracilis, adductor magnus, adductor brevis, adductor longus, and pectineus. And the anterior compartment বা সামনের দিকের আর sartorius, tensor fasciata, articularis genu, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So all these muscles and the posterior compartment muscles, semimembranosus, semitendinosus, and biceps femoris. So muscles of the gluteal region, gluteus maximus, gluteus medius, gluteus minimus, gemellus superior, gemellus inferior, piriformis, obturator internus, and obturator externus. Muscles of the posterior part, backside of the thigh, semimembranosus, semitendinosus, and biceps femoris. Muscles of the anterior or the front side of the thigh, sartorius, tensor fasciata, articularis genu, rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And the medial muscles of the thigh, gracilis, adductor magnus, adductor brevis, adductor longus, and pectineus. All muscles become stiff, সব শক্ত হয়ে যায়, stiff হয়ে যায়, contracture হয়ে যায়. And also the posterior muscles of the leg, which is known as the calf muscles, gastrocnemius, soleus, plantaris, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and peroneus tertius. And also the lateral compartment of the leg, peroneus longus and peroneus brevis. And also the anterior compartment of the muscles of the leg, tibialis anterior, extensor digitorum longus, extensor hallucis longus. All muscles become stiff. Muscles of the arm, brachialis, coracobrachialis, biceps, and triceps. All muscles become stiff. Muscles of the forearm, supinator, flexor digitorum, and extensor digitorum. All the extensors and flexors, supinator, brachioradialis, all muscles become stiff, শক্ত হয়ে যায়, যার ফলে হাঁটতে প্রবলেম হয়ে যায়. And the nerves, the posterior part of the leg, the nerve is sciatic nerve, the medial part obturator nerve, the frontal part femoral nerve, all the muscles supplied by those nerves, posterior part of the leg by the tibial nerves, which is the branches of the sciatic nerve. These nerves become paralyzed and the whole man undergone the paralytic conditions. একটু হেঁটে দেখান. So very difficult to move, a very painful life. So spastic paraplegia. So our choice of prescription is causticum, Hahnemann tinctura sine acris cali, and I do believe by only this medicine the patient will improve slowly, gradually, and insidiously. বসুন. Because not only the symptoms of the paraplegia, but the patient have a strong desire for meat, strong aversion to sweets. মাংস খেতে খুব ভালোবাসেন, এত মাংস ভালোবাসে. টিউবারকুলিনাম, মেডোরিনাম, ম্যাককার্ব, ক্যালকেরিয়া ফস, কস্টিকাম, লিলিয়াম টিক. So desire for meat. And it is a right-sided aggravation. He had already developed kidney in the right stones. So right-sided complaints is more. Desire for meat. The patient is sympathetic in nature, and all the disease symptoms are covered by causticum. So causticum, Hahnemann tinctura sine acris cali, is the choice of medicine, my friends. Please remember this video number. I shall share this video, and I do hope, I do believe this gentleman will get his new life by the Hahnemann's greatest discoveries, the mixed miasmatic antisoric, mainly causticum. Let's prescribe causticum in 50 millisiemens scale of potencies and let's see the result, my friends. তোমাকে আরোগ্যের জন্য যত সম্ভব চেষ্টা করব এবং আশা করছি সম্পূর্ণ সুস্থ করতে পারবো।